Welcome back to Take Two. The death of a patient at Queens Medical Center has sparked a lot of concern here in the islands over Legionnaire's disease. It's a medical condition that many people may not know a lot about. To break down the disease and explain who is most at risk is Ann Massey, a certified infection preventionist with Adventist Health Castle. Good morning. Thanks for being here.
Thank you for having me.
Now, Legionnaire's disease is not very common here in Hawaii, so a lot of people are asking right now, what do I need to know and could I be at risk? So what exactly is the disease?
Legionnaire's disease is a severe bacterial pneumonia caused by the bacteria Legionella. Last year in the United States, there were approximately 7,000 cases reported, but it does carry a 10% mortality risk. Legionnaire's is caused by the Legionella bacteria. It was first identified in 1976 and got its name from the pneumonia outbreak at the American Legion Conference at that time.
And then how is it treated?
It's treated with antibiotics. Legionella also causes a disease called Pontiac fever, which is a mild flu-like illness, and the difference between Legionnaire's and Pontiac fever is you're treated with antibiotics for Legionnaire's, and Pontiac fever usually resolves on its own.
And sometimes you can get confused. You might think you don't have Legionnaire's disease because you have flu-like symptoms or you have a cough.
Right. Legionnaire's is characterized by a cough, shortness of breath, a fever, muscle aches, and some people have chills, diarrhea, and headache with it, whereas Pontiac fever, it's much milder.
And where is the Legionella bacteria found, and how does it, I guess, infect people?
Legionella is found in fresh water, streams, and lakes. It's a waterborne bacteria, but it's also found in man-made plumbing systems or water systems. So it can be found in plumbing, hot tubs, hot water tanks, air conditioning, cooling towers, and decorative fountains.
And who is at risk?
People at risk are the elderly, patients that have compromised immune systems from diseases like kidney disease, cancer, diabetes. Also patients with chronic lung conditions like emphysema, chronic obstructive pulmonary disease or COPD, and then anybody who's on an immune suppressing therapy medication.
And you can't get it from person to person or from drinking water, but how can someone reduce their risks of getting this?
Well, you want to avoid swimming in contaminated lakes and streams that may have the Legionella bacteria. The other thing that you can do is if you have a hot tub and you think that it's contaminated with Legionella, you want to stop using it. Call the health department and follow their instructions for disinfecting the hot tub and then testing the water. If you suspect you have Legionella and you're symptomatic, you want to go and see your primary care physician immediately, and be sure to tell them if you've stayed away from home overnight, been in the hospital, or been in a hot tub in the last 2 weeks. Now, in healthcare facilities, we're required to have a water management program to reduce the risk of Legionella transmission to patients and staff, and that would include disinfecting, cleaning and maintaining those air conditioning cooling towers, flushing the water system regularly, such as shower heads, the toilets and the sinks, and the ice machines, disinfecting decorative fountains with chlorine, and also monitoring the water sources for Legionella by frequent testing and acting on any abnormal test results.
All right. Well, thank you so much, Ann Massey, for joining us from Adventist Health Castle. I know a lot of people are concerned out there, and it's always good to kind of break the fact away from the fiction. So thank you for being here.
Thank you for having me.